Om. 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 Om Namo Bhagavate Vasudevaya Dhanvantaraye Amritakashahastaya Sarvamaya Vinashanaya Trailokyanataya Sarveshwaraya Om Shri Mahavishnave Namah. Om. Namaste, everyone. Today, the topic I want to talk about is preoperative. I'm starting to ask myself questions on how I can help patients be better prepared for the surgery. And I was studying this topic and discussing it with a few colleagues of mine. If there exists a specific orientation of ahara and vihara for patients who are going to need to go to surgery. And one thing crossed my mind is that maybe we first have to think about what is the patient doing as a daily routine in his or her life that made him or her have a disease that needs a surgery to correct it. For example, gallbladder calculus, right? We in common Western medicine, we don't really dig into what causes these stones in the patients. We don't really learn how to teach them how to prevent having them. We know how to treat them. We know how to diagnose them, and we know how to treat them. But we don't know how to say to the patient, how to help the patients not get them in the first place. And this is something that in Ayurveda we can do very well. Why am I telling this? It's because probably if you have to go to a surgery, probably, I'm not saying that all of them, all of the reasons are that, because there are some diseases and affections and traumas that happen in our life that don't exactly have to do with your way of living or what you're eating, but the majority of them do. So in this way, what I'm starting to observe is that we don't, there maybe isn't a diet, a regimen, or a lifestyle regimen specific for patients who are going to go through surgery. But if you stick to what we learn in Dinacharya and Ritutacharya, the probability of you needing a surgery will be very small, if not non-existent at all. And so orienting the patients to change habits prior to a surgery may be a taskful force, because the patient's already nervous and anxious, and because patient's going to go through a surgery, going to go through an anesthesia, and maybe it's not the best moment to make these changes. So what I'm thinking is that we don't have to have good habits in order to go better through a surgery or an anesthesia procedure. We have to have good habits of eating and good habits of ways of life so that we don't get sick and we don't need a surgery to begin with. Okay, so this is something I've been thinking about. My first feeling was that we had to do an Anchivata routine, because I see the surgical and anesthesia as a big injection of vata in the person's system. But maybe if we can speak to the patients and do little punctual things, it will work better than trying to change all of the things that he's already living, or the way that the habits the person already has just prior to a surgery. Maybe it's not the best moment because changing habits is something that we know is very hard, and it's something that the person has to be very motivated. And in that way, maybe the best moment to do this is not prior to the surgery, but after the surgery. If the going through a surgical procedure and going through anesthesia can be something that's really marking in somebody's life, depending on the extent of it. And sometimes this can serve as a motivation for the patient to have better habits and eat better. Okay, so I'll be sharing more things with you in other appropriate times. Thank you for your attention. I'm so happy to have you here. If you have any ideas or any other things that you may think about this topic, please come and talk in contact with me. I want to learn with you also, okay? Thank you very much. Namaste.